This is Professor Emily Mercuri, and we are covering Chapter 2, Drug Names and References, from Essentials of Pharmacology for Health Professions, 9th edition. Chapter objectives for Chapter 2. Upon completion of the chapter, the learner should be able to 1. Describe drug classification systems. 2. Differentiate among the following drug names: generic name, official name, trade name, and chemical name. 3. Explain what is indicated by a number included in a drug trade name. Example, Tylenol number 3. 4. Discuss the purpose of tall man lettering. 5. Explain the restrictions of drug sales implied by the following: over-the-counter drugs, legend drug, off-label drug use, and controlled substance. 6. Discuss the various terms indicating drug actions contained in reference sources. 7. Describe drug references available today. 8. Discuss characteristics that you consider important in choosing the best drug reference. As a reminder, the chapter objectives are here to guide you about what you should focus in on, so if you're having trouble synthesizing the information or deciding where to focus your attention, go ahead and come back to these chapter objectives after you've listened to the lecture. So what is pharmacology? Pharmacology can be defined as the study of drugs and their origin, nature, properties, and effects on living organisms. To provide clarity of the drugs that are on the market, there's a variety of resources we can use, and these resources assist us to know why drugs are given, how they work, and what effects to expect. What are they doing in the body? How are they altering body chemistry? How are they working physiologically to give us the desired effect, and what is that desired effect? There are numerous drug references we can reference that are geared to a variety of levels of readers. This goes from layperson all the way to pharmacist. And so you'll learn later in this course, but when we talk about a layperson, we're talking about your average adult reader. And we really want to gear that towards a 5th grade reading level. That's actually the average that someone can easily synthesize and understand as an adult, is a 5th grade reading level. So this is important when we are considering how to educate our patients and how to create our education pamphlets that we're going to do later in the semester. Another resource we can use is the grouping of drugs under broad subcategories, i.e. analgesics. So analgesics are pain-relieving medications. And so if you are trying to figure out the general properties of what something is supposed to do, if it's under that broad subcategory, you can assume it's going to relieve pain. That's the intention. Now, we're not going to get into specifics on that subcategory, but at least it gives you a broad overview. And then another thing is continuity in the use of basic identifying terms for the names and actions of drugs, meaning that we are using consistent terminology to make it as clear as possible for the consumer. So let's dive a little more into drug classification. Drugs can be categorized under a broad subcategory or subcategories called classifications. Grouping them together according to their therapeutic use is helpful. Drugs that affect the body in similar ways are listed in the same classification. Major drug classifications include therapeutic uses. So again, going back to that analgesic example, the therapeutic use is pain relief. So that's a classification that they fall under. 2, most common side effects. 3, precautions to be used. 4, contraindications, when not to use the drug. So the word indicated, it is recommended. It is intended for that use. So for example, aspirin is intended for being preventative for heart attacks. When you put the word contra, that prefix before the word indication, it means against indication. So it is not recommended or not indicated. So I want you to keep that in mind when you're looking at these words, these kind of prefixes, suffixes, root words. Contraindication, against indication. It's not recommended. Interactions that occur when taking with other drugs or food. And then some of the most common product names, their usual dosages, and comments on administration. On this table, we have some common drug classifications that we'll be going over during this course. In the first column, we have the classification. Number 1, lipid-lowering agents. The therapeutic use is to lower LDL cholesterol, low-density lipoprotein cholesterol, which is what we call the bad cholesterol in the body. So it's the one that tends to clog the arteries, that tends to cause problems. And some examples of this drug in the third column are simvastatin, atorvastatin, rosuvastatin. So you can see that those all have the same word statin in them. That's kind of a standardized thing. When you see that, you know that falls under that lipid-lowering agent classification. The second one is antidepressants. The therapeutic use of antidepressants is to improve symptoms of depression, also used for anxiety and other neurological disorders. Some drug examples of antidepressants are escitalopram, sertraline, paroxetine, and venlafaxine. So these ones you'll see aren't as similar. The last three end in the INE, which is something you may see commonly, but it's not as easy to link them as it is with the statins. Classification number 3, narcotic analgesics. So therapeutic use for these is they relieve severe pain because of that narcotic component. Drug examples are hydrocodone with acetaminophen, oxycodone, oxymorphone, and fentanyl. Again, you have that ONE at the end of several of those, not at the end of fentanyl, so some of them track, some of them don't. Classification for number 4, antihypertensives. The therapeutic use for antihypertensives is to lower blood pressure. If you've ever heard hypertensive, high blood pressure, the word hyper means high. Anti means the opposite. So anti-hyper is going to lower the blood pressure. Some drug examples of this are lisinopril, enalapril, and valsartan. Classification number 5, diuretics. The therapeutic use of diuretics is to increase urinary output. They pull fluid from elsewhere in the body and help you to urinate that out. This is used in people with heart failure or who have trouble pumping enough blood effectively through the heart, and fluid buildup can cause lung and heart issues. They would be on a medication like this. A drug example in the diuretic category is furosemide. Classification number 6, anti-diabetics. So again, diabetics, diabetes, the blood sugar is too high. Anti-diabetics is going to lower the blood sugar. So that's the therapeutic use, is to reduce blood sugar levels or blood glucose levels. We will say blood glucose in the healthcare field, but it's essentially a sugar that the body uses for metabolism. Some examples of anti-diabetics are insulin, metformin, glipizide, and Januvia. Classification number 7, antibiotics. Therapeutic use is to eliminate infection. Specifically with antibiotics, we're talking about bacterial infections. Some drug examples of this: amoxicillin, cephalexin, doxycycline. Classification number 8, anticoagulants. Coagulation is the forming of blood clots, so anticoagulant therapeutic use is to decrease blood clotting. And some drug examples of this are warfarin and Xarelto. All right, a knowledge check for you. Drugs are classified by A, size and color, B, therapeutic use, C, manufacturer, or D, potential side effects. And the answer is B, therapeutic use. Identifying drug names. So drug names can be very complicated. I kind of touched on it in the earlier slide. Each drug can have many names attached to it. When a company produces a new drug, they assign what's called a generic name to it. So after testing's been completed by the FDA, the drug company then gives it a trade name, which is often shorter and easier to remember. So from the time the drug company submits the application for a new drug to the FDA for approval, the company has exclusive rights to market the drug for 5 years. Once it's approved, the drug is listed in the USPNF by an official name, generally the same as the generic name. That's a lot of words. What do we mean by this? Let's go to the next slide. So a generic name is going to be a common or general name assigned to the drug by the United States Adopted Name Council, the USAN Council. And this is differentiated from the trade name by an initial lowercase letter, never capitalized. So keep that in mind. A generic name will never have a capitalized letter. A trade name or a brand name is the name by which a pharmaceutical company identifies its product. It's copyrighted and used exclusively by that company, and it's distinguished from the generic name by a capitalized first letter. This is often shown on labels and references with the symbol, the R, capital R with a little circle after the name, which means registered trademark. I'm going to give you an example. Acetaminophen is a generic name. The trade name of acetaminophen is Tylenol. So you see Tylenol, you see it with the capital T, it's the brand name, and it's easier to remember, okay? And so the acetaminophen is the generic, and that's the name that we are typically going to use in healthcare when I'm giving someone a medication, when I'm scanning the medication. It's going to have the generic name. The trade name is the name it's sold under. It's a branding thing. Another type of name that drugs have is the chemical name. This is the exact molecular formula of the drug, and it's usually a long, very difficult name to pronounce, and it's of little concern to the healthcare professional. So I have been a nurse for the last 5 years. I don't know the chemical name of any of the medications that I administer. I don't need to know that. That's something that you would be using in a lab setting. And then the official name is the name of the drug as it appears in the official reference, and generally the same as the generic. And again, that's usually what we'll be using in a healthcare setting. So I am going to be scanning the acetaminophen and administering it to the patient, and I will tell them I'm giving you acetaminophen. And they may say, I've never heard of that. I usually take Tylenol, and that's a chance for me to educate. Oh, it's the same thing. It's just the generic name for that. So that's something that you need to keep in mind is kind of being aware of both the generic and the trade, because the consumer is usually way more familiar with the trade name than the generic name. Most states have enacted legislation encouraging physicians to let pharmacists substitute less expensive generic equivalents for brand name drugs. Of course, laws may vary from state to state. Some reasons that physicians may state no substitutions and may indicate dispense as written, i.e., don't swap out a generic equivalent, can include 1. Physicians may have a preference for treatment. 2. Patients may be difficult to stabilize on certain class of medications due to fillers being slightly different. 3. Dyes may alter effects in some sensitive patients, leading to allergic responses. What does this mean for the consumer? It essentially means that there are some generic versions of things that are cheaper than the brand name, so that if the physician writes you for that medication, the pharmacist, and you go to fill it and your insurance says, oh, it's going to be $100, but we have this generic equivalent that's $15, that most states have legislation that says the pharmacist is allowed to do that unless the physician clearly states do not substitute. This slide has a comparison of drug names, so there's a little table here. On the left, we have a generic name of doxycycline hyclate. The chemical name, I will take a stab at it, you can laugh at me if you are listening to this recording, is 2-naphthosenacarboxamide 4-dimethylamino 1,4,4A, 5,5A, 6, 11, 12A, octahydro 3, 5, 10, 12. 12A, pentahydroxy 6-methyl 1,11-dioxo 4S, 4AR, 5S, 5AR, 6R, 12AS, 5,6,4,25,0. Woo, that was a mouthful. So that is the chemical name of doxycycline hyclate. You do not need to know that. That is something that a chemist wants to know. It tells you the exact chemical makeup, not pertinent to you, but I want you to be aware that there is a chemical name for each drug. And then the trade names, depending on the drug company, we will use this PDRX pharmaceutical, is Vibramycin, and this is an antibiotic. The next one in the table here, chlordiazepoxide hydrochloride, and the chemical name, I'm not even going to read it because you already heard me and you can laugh at me. You can just rewind and laugh some more if you want. And the trade name of that drug is Librium. So again, the trade name is always going to have a capital letter. It's going to be a little easier to remember. Knowledge check here for you. The proprietary or brand name of a drug is known as the A, official name, B, chemical name, C, generic name, D, trade name. And the answer is D, trade name. So if you see a trade name drug with a number, The number generally refers to an amount of the generic components, which helps differentiate it from an almost identical product. There's an example below on this table that demonstrates the same amount of acetaminophen with varying amounts of a controlled substance. A note here, the higher the number, the more the controlled substance. So trade name, Tylenol number 2, generic name and amount, acetaminophen 300 milligrams with codeine 15 milligrams. Tylenol number 3, acetaminophen 300 milligrams, so same amount of acetaminophen with codeine 30 milligrams. Tylenol number 4, acetaminophen 300 milligrams with codeine 60 milligrams. Knowledge check. The number that is associated with the trade name of a drug refers to A, the number of pills to take, B, the amount of generic components, C, the strength of the medication, D, the significance of a controlled substance. And the answer is B, the amount of generic components. Look-alike and sound-alike drugs are the leading cause of drug errors, and it is imperative, meaning very important, that there be a process in place to reduce the number of medication errors. This helps to ensure patient safety. So there is something called the list of confused drug names that is in every reference text, but there's also a distinct process that we use called tall man lettering. And tall man lettering is created to ensure emphasis is placed on specific parts of the drug name to assist in the reduction of a medication error. So one example, Celebrex and Celexa are two medications that can be confusing because they sound similar and they have different purposes. So to reduce error, Celexa would be written as C-E-L-E capital X-A, and Celebrex would be written as C-E-L-E capital B capital R capital E capital X. The emphasis is placed on the end to grab attention. So Celexa, Celebrex. So you kind of emphasize that capital, those tall man letters, and that helps to distinguish so that we're reducing error. So what is a process set in place to reduce medication error? A, off-label medications, B, prototyping, C, classifications, D, tall man lettering. So of course, answer is D, tall man lettering. So let's talk about legal accessibility of drugs. Drugs not only have classification, generic names, trade names, chemical names, or official names, they also have names that imply the legality of accessibility. And these aren't formal names, these are just names that are kind of broad groupings. So some legal terms referred to drugs include over-the-counter drugs, OTC drugs, legend drugs, controlled substance, or off-label medication. Going into the 4 categories, over-the-counter drugs have no purchasing restrictions by the FDA, with some exceptions such as pseudoephedrine, which is over-the-counter, but you must be 18 or up to buy it, sometimes kept behind the pharmacy counter. The name that you might be familiar with for pseudoephedrine is Sudafed, is the most common trade name, and people can get high off of it, essentially. It's a miserable thing to do and to see someone come down from, as I've had some patients that have done this, but it's still over the counter, but it has some restrictions. For the most part, all over the counters, they're not highly restricted by the FDA. You do not need a prescription. These are things like Tylenol, ibuprofen, those kind of things. A legend drug is a prescription drug determined unsafe for over-the-counter purchase because of its possible harmful side effects if taken indiscriminately, meaning if taken without guidance. Examples, birth control pills, antibiotics, cardiac drugs, and hormones. You can imagine why most of those things you would not want to take without the guidance of a physician. For example, birth control can lead to increased risk of blood clots, so if you have some kind of disorder that puts you at higher risk, you might need to consider other options. So that's something your physician can work with you on. Antibiotics can harm your body if given too often and if they are not treating the actual bacteria that they are trying to target. And that can wipe out the healthy bacteria that is in your gut and in your own microbiome within your body. Cardiac drugs We don't want to affect our heart in a way that we are unintending to, so that needs to be given with a physician oversight. And hormones, again, we don't want to alter our own body hormones without knowing that there are some side effects and that a physician should guide us and should be checking those levels carefully. The third category is controlled substances we talked about in lecture 1. So these drugs are controlled by prescription requirement because there's a danger of addiction or abuse, indicated by schedule numbers C1 to C5. Off-label medications are drugs used in a way not indicated on an FDA label. An example would be an antidepressant that's used to treat nerve pain. Another really common example is there is a diuretic called spironolactone, and the off-label use of that is actually to treat hormonal acne. So when you have it prescribed to you, there should be a note there, this is what it's being used to treat. It's off-label. The drug wasn't originally intended for this purpose, but research shows that it is effective. Below is a drug label that illustrates the information that should be contained, including the trade name, in this case Percocet with a capital P, and the generic name of the two drugs that are within Percocet, which is oxycodone and acetaminophen, and the controlled substance marking. So if you look closely at the label, you will see here that it says DEA order form required, meaning that it is under regulation for being a controlled substance. Knowledge check activity. Which is an example of a legend drug? A, birth control pill, B, pseudoephedrine, C, extra strength Tylenol, or D, aspirin. And the answer is A, birth control pill. Indicating drug actions. So when researching drugs, the various drug references will utilize a similar format to describe drugs. It's important to understand the specific headings and what's found within the headings used in reference tools to quickly obtain information. So headings usually include indications, actions, contraindications, cautions, side effects / adverse reactions, and interactions. So indications is the list of medical conditions or diseases for which the drug is meant to be used. So this medication is meant to be used for heart failure or diabetes or whatever the condition the drug is meant to treat is under. Actions is the description of cellular changes that occur as a result of the drug. Again, if you are looking at this from a consumer standpoint, the medical terms may be hard for them to understand, but in a basic level, what is occurring within the body with the drug being put in the system. Contraindications, a list of conditions for which the drug should not be given. So if you have this medical problem, do not take this drug. It could be dangerous. Cautions is a list of conditions or types of patients that warrant closer observation for specific side effects. The one that comes most readily to mind is certain medications, they will pop up on the screen when I'm administering them to a patient. They will say, use caution when administering this in a patient over the age of 65. So age can be a caution. There's many things that can be a caution. Use caution in pregnancy, etc. Side effects / adverse reactions means a list of possible unpleasant or dangerous secondary effects when given the drug. Usually we would say side effects is more mild and adverse reaction is a more major issue. And then interactions is lists of other drugs or foods that may alter the effect of the drug and usually should not be given during the same course of therapy. So sometimes medications have the potential to cancel each other out, or they can potentiate each other, meaning if you take them at the same time, one can make the other one have a stronger effect, which can also be dangerous. So you always want to look at those interactions when you are either taking your own medications or giving medications to a patient. Knowledge check. A list of other drugs or food that may alter the effects of a drug and should not be given during the same course of therapy is known as an A, contraindication, B, caution, C, side effect, D, interaction. And the answer is D, interaction. At the beginning of this lecture, I talked about some resources we can use, one of those being drug reference guides. So it is imperative or very important to become knowledgeable about the drugs that you will dispense. When they say dispense, they mean you're giving them out to patients. There are many different drug reference guides, and selecting one that is most suitable for your practice is important. The three most utilized are 1. Physician's Desk Reference, the most widely used and is available in 3 versions to include online, mobile app, and book. 2. The United States Pharmacopoeia and National Formulary, available online only. And 3. The AHFS Drug Information, American Health System Formulary Service Drug Information, available in paperback form by volumes. So the first one, PDR, the pros are it is available in 3 platforms for free, available for physicians, nurses, and consumers. It has drug labels, patient resources, and photographs of the medication, which is very helpful. I cannot tell you how many times someone will bring in a little baggie of pills and say, these are my daily meds, and I'm looking at them and trying to figure out, what med each one is. And just so you know, pills do have numbers on them. If you search, let's say, white round tablet with number 123 on it, it will pop up something within these formularies, so that's very helpful. Cons of this PDR is it contains only the drugs that manufacturers pay to have incorporated, and it's incomplete with regard to over-the-counter drugs, so you'll have to buy a separate version, which is the over-the-counter version of the text. The USP drug reference, the pros, it's available online. It provides standards for chemical and biological drugs, substance, dosage forms, and compound preparation. Cons, it does not include photographs. It's more geared for laboratory and manufacturing, so I don't think that will be as helpful for us, and is not easily identified in terms of nursing implications. It's kind of confusing to use for people in the nursing and physician realm of practice. And then the AHFS, the pros, it's distributed to practicing physicians in a single paperback volume, including mobile reference and handbook of injectable drugs. It's easy to read, it's concise, it's arranged by classification, and it also has off-label drug indicators. Cons, it includes information that's not necessary for the health professionals, such as the chemical information, and does not include photographs of medications. So you can see that those all have their own perks, and then they have some things that may make them less desirable, depending on what you're looking for. Knowledge check. Which drug reference source provides incomplete information on over-the-counter medications? A. PDR, B. USP/NF, C. AHFS, D. None of the above. And if you remember, the answer is A. PDR. You would have to buy a separate book to have the over-the-counter information. So when you're selecting a drug reference that is the best for you, it is imperative that you can find information and that you feel comfortable with the information to ensure that patient safety is being met. That's a big responsibility for all of us, and we want to make sure that we have the information at hand that we need. Some things to think about when selecting the most appropriate source may include 1. Accessibility. Is it easy for me to access, and can I get to what I need to get to quickly? The ease in finding that information. Being able to verify drugs through pictures, if that's important to you, if you're a visual person, or like I shared, you come across getting handed pills without labeling. Locating contraindications, side effects, and other imperative information quickly. There may be a time when you are in a critical situation in a hospital setting and you're like, I'm not familiar with this medication. You want to look up the contraindications really quickly. Can you access and flip through that quickly and easily? And then the reputation of the material that's printed, you want to make sure it's vetted by multiple sources and that it's a well-known, established kind of reference material. As I shared, a lot of times the hospitals have their own reference text kind of built in. So when you are giving a medication, you can click on a little icon and it will expand and give you a bunch of the reference text, which is very helpful. Knowledge check. Which characteristic would be important when choosing the best drug reference source? A. Displays the cost of medication. B. Easily recognized headings. C. Provides information on physicians. Or D. Provides archived drug research. And the answer is B, easily recognized headings. So your self-assessment for this chapter: can you differentiate between the terms trade, generic, chemical, and official as they relate to drug names? How does tall man lettering help to reduce medication errors? Reflect on that. And can you explain the terms used to describe drug actions that appear as headings under each drug in a drug reference source? This was Chapter 2. Thanks for listening.